The guy who invented the Q-tips was like, I am going to incept an entire society to believe that without these, your ears, which nobody can see in really anyways, are filthy and disgusting.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now here are your hosts, Dr. Jordan Strong and Kevin Ziener.
Back with another brand new episode of Ask an Audiologist. I'm Kevin Ziener.
I'm Dr. Jordan Strong.
Today's article was written by Dr. Taylor Shabbat of Atlantic Hearing Care in Swampscott, Massachusetts. And in her article, she asks the age-old question that we will answer here today. And that question is, why did a ball of wax fall out of my ear? Something that we have all asked ourselves and our friends and our families before. It's obviously been a few weeks since we've talked about earwax, Dr. Jordan, so it only makes sense that as we, turn our sights towards winter, I don't know what any of this has to do with this, but we would ask ourselves, why did the ball of wax fall out of my ear? So I pose that question to you.
Yeah.
Why did that ball of wax fall out of my ear?
Because your ear is doing what it should be doing.
Thank you guys so much.
Honestly.
That's a wonderful episode.
Bye. See ya. Yep. I mean, yeah, for the most part, it's that simple. So our ear canal, one, it naturally produces wax.
Yep.
Most people have wax. It doesn't mean that you're dirty or that you don't clean your ears. Your ears actually clean themselves.
Now, I've heard that before. I've said it before. I don't actually fundamentally understand how the ear cleans itself. Like, is there a real, hey, we know it cleans itself because it does this? Or is it just like, well, the earwax falls out, so thus it cleaned itself?
Yes.
Okay. Explain that to me, because that's a question I've never actually asked before.
Yeah. So wax is actually made up of dead skin and oil from our sebaceous glands within our ear canal.
Got it.
So both of those things need to kind of have turnover, just like any other part of our body, our skin and that type of thing.
Sure.
So one, it's getting rid of the old and constantly creating new.
Okay.
Wax helps to keep our ear canal lubricated and that pH balanced in our ear canal. So that's really important. The other thing is that it's constantly, our skin is growing and turning over. So it grows from the most inner part of the ear canal toward the eardrum outward.
Okay. So it's kind of, can I do a dumb guy metaphor here?
Hit me.
You know the Golden Gate Bridge?
Yeah.
They start painting it on the bay side before they go all the way to, I just assume, the Napa side. So it's kind of like new, pushing, not really pushing, but like kind of theoretically pushing the old paint away. And then they start again.
That's right.
That's kind of what the ear does.
Yeah.
It's kind I just needed to make it make sense to my stupid brain. So
there you go. It's kind of like our fingernails. Okay. How they grow.
That's probably a more apt metaphor. How our fingernails grow, you idiot, is not like the Golden Gate Bridge.
That was a good one, Kevin.
Thank you. I appreciate that. Okay, so it starts closer to the eardrum and then pushes out. Okay.
Yeah. So as it pushes out, if you will, that the longer the wax stays in the ear, the more dry it gets. Okay. So naturally, if your skin is growing and it's moving outward and you don't have an overproduction of wax, if you're not one of those people who just tends to produce more wax.
That's just like biological distinct to the person. Okay.
Right. Then your ear's naturally going to clean itself.
So if I'm some Joe Schmo and I have an impacted ear full of wax, is it fair to say that chances are I did something to impact it? It can. So it can be no fault of your own that your ear just naturally produces more wax than what that skin is growing. Okay. And then it just builds up. Got it. Or it can be you're using something like Q-tips. Got it. And then what happens is when we put the Q-tip in our ear, we're getting a little bit of that wax off onto the Q-tip, but the mass majority of that, it's just being shoved further down into the ear. And then it's got to work even longer to work out. I've asked this before, but I want to ask it again. Like, should we just avoid the ear canal at all costs?
I love it. Okay. I love it.
Just don't do it.
That's
just
right.
Keep it on the outside.
That's right.
Okay.
Yeah.
Fair enough.
Yeah, for sure.
So
no keys and bobby pins, please.
I feel like that should not have had to have been said, but like no keys or bobby pins, please.
Sadly enough, it needs to be said.
Yikes.
It happens more often than you think.
Really?
Yeah.
Like they just couldn't find a Q-tip and they're like, well, I guess my house keys could do the
just
remedy.
make it in there. Yeah, and typically their ear canals will start to itch.
Yeah.
So then they're scratching them.
Yeah.
Yeah. And then
with the key?
Yeah, with the key. And then you're just scratching your ear canal and that hurts. Don't do that.
You've seen that before?
Oh, yeah.
Oh, yeah.
Oh, yeah. Definitely.
You're like 9 times this last week.
Really.
So theoretically, if we are just, within the baseline of a normal ear, we never, ever need to do anything to clean out our ears.
Not really. If you know that you're one of those people that tends to produce more wax and you're the type of person who doesn't want to have to go in to have it removed professionally, which we always recommend that it gets done professionally. Yeah. But if you would like to try it from home, there are some things that can be done.
Oh, hit us with them.
But there's a few caveats there.
Yeah.
One,
none of them involve keys, by the way.
Please don't.
Okay.
Don't do that. But if you know that you have a hole in your eardrum, don't try to remove that at home. Because anything that is typically used to treat earwax removal at home is going to involve some type of liquid or substance. Okay. So things like earwax MD, great for that because it's going to really help soften up that wax.
What's earwax MD?
Yeah, so it's a little liquid. It's got a little dropper where you can lean your head over, put a couple drops in your ear, let it sit for a little bit, and then you can either sometimes just tilt your head over and it's going to fall out.
Oh, no way.
Or when you get in the shower, you can just kind of wash it out and it'll naturally fall out.
Cool.
That's best case scenario.
Okay.
There are other things. There are Debrox. Some people use peroxide, things like that. While they are commonly used, some of those things can dry out your ear a little bit more. Mm-hmm. And then our ear says, hey, I'm dry. I need to produce more wax to lubricate the ear canal again.
So it's just this horrible self-fulfilling prophecy at that point.
Exactly. Okay. So one, it's best to just come in, let us have it, just let us remove it. Okay. But if you absolutely need to do it from home, you can try something like Earwax MD to have that removed at home.
But short of that, we really shouldn't be doing anything else.
Right.
It should just be falling out.
Yeah.
Like if I'm just leaving my ears to do their ear thing, like generally what size wax should fall out? And I imagine it happens when we sleep, right?
Right.
More often than not.
Or showering.
Okay.
Or on your AirPods or whatever you're using, you're going to see it come out on that.
Got it.
And it's normally pretty small. I mean, a lot of times it can be like kind of flaky.
Yeah.
Because it's kind of dried out by that point and it just kind of falls out.
I guess then I'm sitting here being like, so why did we ever start thinking that we needed to clean our own ears out? Like, where did that come from?
That's a great question.
I don't know that you have that answer, but it's like...
I don't have that answer.
The guy who invented the Q-tips was like, I am going to incept an entire society to believe that without these, your ears, which nobody can see in really anyways, are filthy and disgusting.
Right? And now that you say that, I'm kind of curious. I wonder if it was ever printed on the box for Q-tips to clean the ears, because right now, if you look on a box of Q-tips, it does not say to put them in your ears. It is not for ear use.
Yeah. Listen to that again, what Dr. Jordan just said. On the box of Q-tips, it says, do not put in your ears.
Yeah.
And yet, what do we do with Q-tips? We jam them in our ears morning, noon, and night.
And one of the other scary things about that, and even, I mean, I guess if you're using a bobby pin or whatever you're putting in your ear, is I've seen some patients that have come in that were doing that, and they've had like a kid come up next to them and like hit their elbow, and they have perforated their eardrum because they were trying to clean out their ear, or like hit the wall, turn and hit the wall, something like that, and it perforates their eardrum. It went through it.
Just don't do it.
Extremely painful.
Just go see Dr. Jordan and her colleagues.
Yeah.
Well, I could talk about all things earwax for like the next 9 hours, but alas, we only have 10 minutes. So to find out more about earwax and how you shouldn't actually do anything with it because your ears are doing it yourselves, please visit askanaudiologist.com. Dr. Jordan, thank you so much.
You're welcome.
We'll see you guys next week.
See you.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only and does not substitute for professional medical advice.
it is a very emotional thing for the patients who are experiencing it, which is why we oftentimes pull in other professionals like psychology and make sure that they are being that the issue is being addressed from that perspective as well.
Sure.